Hi there, it's Dr. Clark Damon again, and I want to talk to you about what Texas Implant Institute has for 2025. We've got some great course offerings that we are going to be doing that I'm very excited to share with you about. For those who don't know, we have been a Neodent partner since 2019. Since 2018, when we started Texas Implant Institute, to now, we have done over 40 courses and taught well over 300 doctors from across the United States. And it has just been a joy to teach. I love to teach. I really enjoy the mentorship that we get after the course. I can't tell you how many people will text me questions, text us, hey, Dr. Damon, what do you think about this case? What should I do? Hey, who's your marketing person? You know, we're pretty transparent. And, you know, if you're serious about wanting to get into the full arch game, you need to come check us out at Texas Implant Institute. We have a continuum this year, starting with Surgical 1, which is overdentures. And then we have our full arch course, and then we kind of end the season with our zygoma and pterygoid course. And so definitely not for everybody. You can start somewhere and leave off, but it could also be a really nice course continuum for everybody. So if you're interested in finding out more, I've got a lot of reviews online at texasimplantinstitute.com, as well as a Texas Implant Institute YouTube site. So if you check us out there on YouTube, you can see I've got a whole bunch of videos of some of the podcasts that I've done. I've also got videos on developing a full arch dental implant practice. I've got videos on how to use the NeoConvert system. We've got videos on how to pull teeth, make incisions, thin the palate, and a bunch of reviews from attendees who have taken the course. So check us out on YouTube. I think you can kind of get a really good feel about what's out there, as well as you can register and learn more at texasimplantinstitute.com, as well as you can follow us on Instagram, Dr. Clark Damon, and you can also follow Texas_implant_institute on Instagram. So, starting off the year, February 7th and 8th, we have got Surgical 1 implant overdentures. This is going to get the doctors who are already doing singles into be able to doing, more full arch concepts. This is a great starting place to make the jump from singles to fixed full arch without you having to make the jump there, right? So this is to help bridge the gap. And this is a wonderful place to start because you're going to learn, how do we extract an entire mouth? How do we extract an entire mandibular dentition? How do we do immediate implants? Okay, so we go over all of that, and you can see this is a clinical picture of a video that I show, where we've done some of the guiding principles of reflect out the mental foramina well, have a good, nice, flat alveoplasty, begin to start our implant osteotomies lingual, okay, so that we can maintain more buccal bone. So all in all, a very excellent place to start. The target audience, again, currently placing single implants and wanting to get into the full arch game. What do the docs get out of this? What is the intended result? I want these docs leaving our Surgical 1 implant overdenture course doing more quote-unquote larger cases, where they're just learning to do let's understand perfect pre-prosthetic surgery, understand incisions, flat design, do some snap-ins, and getting good experience in full mouth extractions so that when they jump into fixed full arch, it's not as big of a jump. So often I see docs who take my AOX cadaver who have more limited full mouth experience. They are somewhat limited in full mouth extractions, immediate implant placement, and limited prosthetic experience. Now, it's okay for them to take the All on X cadaver course and not necessarily be as well in tuned to a little more of these basic principles, because oftentimes they learn what they don't know. But it is a better way to take a really good entry course so that when they come and take the full arch cadaver course, they're not spending time learning or focusing on more basic principles and can learn better full arch concepts. So what I've got, April 11th and 12th, we've got the full arch flagship course that everybody rants and raves about. This is on cadaver, just like the surgical one. All of our education is built on cadavers. Everybody's heard about this course. This is probably the number one course for full arch that guys love to take because it gives them so many clinical examples, clinical pictures, clinical videos. They get to learn with cadavers, and so this is just the amazing course. Target audience, entry level. If they haven't done a fixed arch, that's great. You got to learn somewhere. You got to learn the basics. And so if they haven't done an arch and they're good at, say, implant overdentures, great person to come take the full arch course. Guess what? Even if they've done 500 or 1,000, one of the biggest compliments I've gotten before was by a guy who I know has done thousands of arches. He said, I've learned 7 pearls from just coming here and learning with you, because we're able to critique how you do surgery, how you do your flaps, what you use to make your flaps. So even if they've done 500, 1,000 or more arches, I still think that this would be a great course for them to come and learn. Docs tell me all the time they and their practice get propelled after taking this course. So this is a big lift when they go back. These docs are going to be ready to buy implants and sell arches. What do we cover? We cover neoconvert, GM short, GM long, and we cover analog and digital conversions. It's not a course designed to learn digital, but we'll talk about principles and techniques on that. How do we do this course? Lecture, hands-on, and cadaver. And here I am. I'm gonna bet. Why not just hear from me about this course? A lot of the things you learned in dental school, really only apply to general dentistry. The oral surgery stuff, they keep secret. We're able to kind of share those secrets with you and ultimately propel your career. If this course existed when I was fresh out of dental school, it would have propelled my career 5 to 10 years ahead. If you're newly graduated and you're a new dental student, there is nothing wrong with coming to take this course. You will learn what you don't know, what you need to know, and you'll learn how to do surgery better, take out teeth better, suture better. You will be better prepared. I've spent hours upon hours generating a wealth of knowledge in a booklet that everybody gets to take home and re-reference. It's all literature backed, nothing is falsified, lots of good clinical examples, lots of good clinical videos. It is a way to propel your career. Whatever you spend on this course, I promise you it'll return, thousands of times back. And here we have one of our cadaver course attendees give his thoughts and his review with us.
My name is Dr. Mohammed El Assouli, and I've learned so much at the Texas Implant Institute that I decided to come back and advance my skills with the All-in-4 course. I think it's just a great experience all the way around, from the lecture to the notes to the hands-on experience on the cadavers. It really gives a good sense of how the clinical side would be compared to just reading about it in the book or in the notes. Being able to get this hands-on experience on a cadaver, I think it's even better than starting to do this on an actual patient, because when you have a cadaver to work on, you have the freedom to kind of go a little bit extensive with your preps just to see what could go wrong and try to fix that on the spot. And Dr. Damon did an excellent job of giving us feedback on what we did right, what we did wrong, and when we did it wrong, how we can fix it. Leaving here today, I'll be going home with more confidence in my skills.
So more confidence in his skills, telling them what they did right, what they did wrong, and how to fix it. That's exactly what we do and what we strive to do. Here's another full arch AOX cadaver attendee review.
My name is Rinto Adeniran. I am from Louisville, Kentucky, and I am here at the Texas Implant Institute because I wanted an experience with the cadaver so I can really dive in and really see where things are at and know where things are. What's different about this course from others that I've taken really is the cadaver aspect of it. Now, I've taken a few other courses. It was just all textbook, and I just thought this course is pretty unique. Leaving this institute, I'm going to feel very comfortable, and actually my implants will get longer, which is good. So I'm really excited about that.
Awesome, Rinto. We loved having you. All right, guys, and the last course of our continuum, of course, is going to be zygomas, pterygoids, and more. We're going to talk to you about transsinus, about transnasals, nasal crest, lateral nasal. We're going to go over PATSI protocol and all of it. And the really cool thing is that this year we've got Vishy Broman is going to be out and is going to be helping teach this course. So we are super pumped, super excited, really glad to have him on board with us. Again, it's going to be 16 credits, same format. It's going to be lecture, hands-on, and then cadavers.
So behind me, we have clinicians working in pairs with one cadaver. Each doctor will do one side. We're going to get to watch them make incisions, and we're going to get to watch them extract teeth. After this, they're going to do the PATSI protocol, posterior pterygoids. They will either do a nasal crest, possibly transnasal, and then they'll do the zygomatic. They'll finish the day up by doing their anterior superior quad.
So if you don't know what an anterior superior quad is, you better come find out. And, you know, we're just super excited. Here's a review of one of our guys, one of our recent, Dr. Isaac, one of our recent attendees.
Hi, my name's Dr. Isaac Qureshi. I'm from LaGrange, Illinois, right outside Chicago. Overall, my experience has been really wonderful here at the Texas Implant Institute. This course is great because, you know, it's not a beginner level course. There's layers of information you had to come in knowing, and, you know, kind of adding to what I already know. This is awesome. I chose this course because I was trying to take it to the next level. You know, I want to go back and start trying pterygoids right away. It's just a good course. You know, the instructors are awesome. The instructors really know what they're doing. They're very experienced. They're very learned. Honestly, I didn't know much about it. My neo-dev rep recommended it. And, you know, after taking it, I was very pleasantly surprised.